Welcome, Dr. Rachel, to our SB Talks. Thank you very much for making the journey from Abu Dhabi. We're very grateful to have you here.
It's a pleasure to be here, Hannah.
We know that you're here to talk about your new role, but I would like to start with what drew you to veterinary medicine?
Okay, a simple answer. I come from a region of England called Yorkshire, North Yorkshire. There was a very famous vet called James Herriot. He was actually a proper vet.
A real person.
He's a real person. I believe his real name is Alf White. But they made a TV series about him, and he was a large animal vet and small animal. He was mixed, and he used to go around Yorkshire treating all manner of animals, and the series was called All Creatures Great and Small. So I used to watch this programme as a child, and I was utterly in awe and inspired by the capabilities of this guy. And I said to my mum, I am going to be a vet. When I was 5, I said that, and I did everything I could to hit the target and achieve my goals with my support of my family. And I was blessed to be able to fulfill that dream.
Amazing. So once you had graduated from London, what did you do next?
I went straight into small animal practice. Sadly, I have allergies to certain...
You didn't do the James Herriot thing then? You did
Well, this is the reason I didn't do the James Herriot thing, Hannah, because I discovered that fate or the higher powers were going to laugh at me a little bit, and they decided I was highly allergic to horses and pigs. So my large animal dreams were shattered by my inability to breathe around that species, and breathing seems to be fundamental for life, unfortunately so. So I decided to focus on small animal. So I worked as a small animal vet in Lancashire and the northwest of England for 5 years, until the fateful day. Well, it wasn't a fateful day, it was a blessed day when I saw a job advert saying, are you looking for fun, sun and adventure? Small animal vet required for bustling practice in Abu Dhabi, United Arab Emirates. And I decided I did need that in my life, and I was again blessed by higher powers to be offered the role. And 3 months after that, in September 2006, I was on a plane with my 2 dogs, my 2 rescue dogs in the cargo. And we arrived in 2006, and I have been here and very content here ever since.
This is what we want to talk about, particularly today. So this was an opportunity that came about with AWAD. Could you tell us a little bit about AWAD and your role in it?
AWAD stands for Animal Welfare Abu Dhabi. The idea of Animal Welfare Abu Dhabi had been evolving for quite a few years before I was approached to come on board as the CEO. Now, that sounded like a very grand title, and it was quite daunting, because as a vet, I've never owned my own business, I've never had my own practice. So I was fully aware that a CEO role would be a lot of responsibility. And not just responsibility in terms of, having staff and driving an organisation, but a big responsibility to achieve the mission of the organisation.
It's essentially a startup.
Yeah. But what was exciting about the opportunity was having a blank canvas, being given the opportunity to research where are the animal welfare needs for Abu Dhabi, where are the current challenges, what solutions could Animal Welfare Abu Dhabi develop and implement to drive real change. And as I stated, this organisation, the idea of this organisation wasn't that it was just grassroots. It's an organisation that sits somewhere in the middle as a bridge. So I was, informed that this organisation's funding would initially come from semi-government sources.
Okay.
And in the future, the organisation is expected to be independent and to be financially solvent and self-sufficient, which I am convinced it will be. But initially, that was a really positive for me. Having worked in Abu Dhabi for 19 years and having seen firsthand as a vet the daily animal welfare challenges, particularly for companion animals, that's where I'm going to see the challenges. I saw accepting the role of CEO of AWAD as an opportunity to drive some real change, to drive impactful change at a level beyond one individual patient on my table, to take that and to scale it up with support and backing financially and governance and advocacy wise of some real key players in animal welfare.
Amazing. What do you think you've drawn on the most when you've been developing a strategy and developing some of the campaigns? Has it been your clinical experience? Has it been what other countries have successfully done if they've done a similar initiative? Has it been a combination of all of these things?
I've been afforded a year to do some research. So I came on board in November 2023. We started employing staff a year afterwards, key staff that we need to launch, and we launched February 2025. But during my year of discovery and research, as I like to call it, when it was me and my thoughts, I was able to do a survey, which was put out to Abu Dhabi, Al Ain and Al Dhafra region, which was very insightful. And that certainly afforded me the ability to understand where Abu Dhabi's challenges are, and then to take that and benchmark it against other countries to see if they had similar challenges and what solutions were they already implementing that were working and that were sustainable and that could be funded. So benchmarking was definitely something we did do.
Yeah.
But also I drew a lot on grassroots clinical experience and community feedback. So having worked on the front line, so to speak, you definitely take the feedback and information from the clients that are on the front line working with animals and advocating for them, and you can see where things are successful and where things are not successful, and then scale those up. So it was a combination. The strategy for AWAD was evolved through survey and talking to key government stakeholders as well. I was afforded that benefit of talking to the likes of the Animal Welfare Department of Department of Municipality Transport, Ministry of Climate Change and Environment, the police, ADAFSA, so Abu Dhabi Food, Agriculture Safety Authority. All of these government entities have key roles and a shared responsibility for animal welfare in Abu Dhabi, and I was afforded to talk to them. So I felt like I had an all-encompassing approach in my research phase to then develop the strategy that we have developed for our first 3 years. And that strategy is focusing on companion animals to begin with.
That was going to be my next question.
I mean, that is where my strength lies and where I feel I can drive change and impact. And as the team expands, I mean, there are definitely welfare challenges across all species in the whole world. We're not just talking Abu Dhabi, the UAE, we're talking the world. And I am not just a lover of cats and dogs and rabbits and small furry animals. I'm a lover of all sentient beings, such that the team will expand. And after the initial first 3 years, we will include other species, such as horses, camels, donkeys, birds, etc. Yeah.
Brilliant. In the first 3 years, then, can we talk about some of the sort of initiatives that have already been launched and will be in the pipeline?
Indeed. So our flagship initiative that we launched at the time of AWAD's official public launch, so February 21st, was our community cat care programs. So in a nutshell, a community cat care program is a sustainable, humane, welfare-focused, all-encompassing program to help humanely reduce the cat population in a geographical area such that once you've reduced the population and stopped the breeding, it will naturally decline itself over the next 5 to 10 years. So we're not coming in and removing cats. We're not coming in and relocating cats because it's proven worldwide that those strategies do not work. They don't work because when you remove a certain number of animals from a stable from an area that has holding capacity for those animals, you simply create a gap, which people refer to as a vacuum, which then sucks other cats in. I mean, it'll be the same with dogs. If you did it with a dog community, other dogs would come in to utilise the resources from the gap that's been left. So TNR is still worldwide the only proven effective way of controlling feline populations that are strays. So our programs centre around that. So TNR, so trap, neuter, return of the cats. Although at AWAD we actually like to go sort of 7-star. So if TNR is 5-star, we're going 7-star, which is UAE style, as I like to say.
Yep.
So we are adding in vaccinations for the cats, and we're also microchipping the cats in the communities, such that we know that they are protected against rabies for public health risks.
Yeah.
We are a rabies-free country, but let's stay rabies-free. Let's vaccinate these cats for rabies. And also to protect the cats against diseases that might cause them loss of life, we give them cat vaccines. And we microchip for traceability and to ensure that we have full records and to collect data on our cats, because collecting data from these programs is going to be key to having them funded in the future by other parties, and also to show impact. So TNR, TNVMR is the key, but also there's controlled feeding, Hannah, which is where Animal Welfare Abu Dhabi's beautiful partnership came in with SV companies, and specifically Royal Canin, who are one of SV companies' brands that they supply to the UAE. So we need to have control of feeding in order that we can have visibility on the cats that we're trapping, to help us to have the ability to have them on a schedule so we can then coordinate trapping to sterilise them. In addition, is to make sure that they're supported. These cats do need daily food, and they need the best food with the right protein content and the right fat content to keep them super healthy and in tip-top shape, so that we have to spend less in our communities treating them for health problems. You are what you eat, and that applies to animals. So partnering with Royal Canin as our official nutrition partner for 2025 was amazing. And it was also a huge boost to our programs. And I think people underestimate the cost to feed X number of cats. So across 4 communities...
That's true.
Yeah, so across 4 communities that we're bringing community cat care programs to this year, we estimate we have 600 cats. And we do calculate daily food consumption because it's controlled feeding. It's not just feed everybody. Although we don't have control of people's owned cats that might love Royal Canin delicious food, and who wouldn't? They'll go to our feeding stations and I'm sure have a second breakfast.
Yeah.
But yeah, so once you actually work out how much food you need per year and then you do the number crunch, it's a significant contribution to our program. And the great thing is that when we have sponsorship for the food, we can then put that money from the program budget into things like sterilising the cats. It also means that we've got extra money for the Sick Health Fund, so Sick Cat Health Fund. We're supporting 600 cats, and during the year that we're supporting them, some of them are going to have a health problem.
Yes.
And cats don't carry a health insurance card in their back pocket like we are supposed to. So we needed to have a plan for that and a budget for that. So the funding that we're not allocating to feeding the cats can go towards some of the more common health problems we need to help them with. So this would be like teeth, dental problems. So many of these community cats do get early dental disease and do require tooth extractions. So it's lovely to be able to say, yep, please go ahead, extract those teeth in conjunction with sterilising, because we have budget for that. If we have more funding for Sick Cat Health Fund, it means that we can fund stuff that, unfortunately, in other countries with their programs, would mean that some sad decisions are going to have to be made because there's no funding. And at the end of the day, budget always comes into whatever programs we're running. So we're super grateful that we have sponsorship for the food. And also it's important to us that the cats are being fed quality food.
Yeah.
And I can say that the cats are loving Royal Canin food. We've not had any bad reviews.
Oh, excellent.
None of the cats have filled out our feedback form to say that they don't like the taste or they don't like the size of the kibble.
Amazing.
It's been well received. Very all for communities.
Amazing. Perfect.
The third aspect of a community cat care program is education. It's always education, and what I've learned is that education isn't just needed for the residents of these communities. The most education is actually needed the higher up you go in terms of workers for the communities, facilities management, security, community management. Education is for everybody. And I am proud to say that everyone now knows what TMVMR mean in our communities, whereas nobody did to begin with at the higher levels.
I do have a couple of questions from the vet perspective. Do you screen these cats for certain infectious diseases when they are neutered? The vet and me really, would like to know as a data point. That would be wonderful to...
This is an amazing question to ask me, and a vital question.
Imagine.
So coming on to the sort of design of the programme in terms of the veterinary nitty-gritty, the veterinary aspects, there are things you need to decide if you're going to do them or you're not going to do them when you're doing a TNR programme. And one of those things, the key things you have to decide from the outset, and you have to be all in or all out, is whether you're going to do any viral disease testing. The most common viral diseases that you would be looking to test, I guess worldwide, within any community of cats that you're going to TNR, would be the two diseases, feline immunodeficiency virus, so FIV, and also FELV, which is feline leukemia virus. We don't really have a lot of FELV in UAE, in Abu Dhabi, although reports are from vets and clinics that I liaise with that they're now seeing more cases.
Really?
And whether that's because of the transient nature of the UAE and people bringing in cats that do have FELV and they mix with community cats. Although FELV is spread from prolonged close contact, but they are sharing food bowls in these communities, which is a way of exchanging. But FELV wasn't really a big one on my radar. The big one to decide was feline immunodeficiency virus, FIV. Now, if you go to the International Cat Care Guidelines on TNR, their stance is that if you are going to test for FIV and you have budget, because an FIV test will cost you approximately 150 dirhams extra per cat in your program. And for some clinics, that could be the cost of the whole neuter for a male, which is a big spend per cat. But essentially, if you add it in and you do find a positive, no matter the clinical condition of that cat, whether it looks like a beaten up tomcat that might definitely smack of FIV, or whether it looks like a beautiful, pristine cat, you should exclude that cat from your community cat care program, which sadly means making a decision to euthanize it. The rationale behind that is that this cat has no guarantees to be healthy after you spend your money on TNR. So you can put money into sterilizing it, you can vaccinate it, you can microchip it, but with it having immunodeficiency virus, at some point in its life, that virus is likely to become active and cause secondary problems, which will cost more money in the long run, and also have a sick cat in your community. We only want healthy cats. Does AWAD FIV test? No.
Okay.
And the reason we don't, it's not necessarily a financial decision. I'm going to be honest here. It's an emotional decision. I work in a vet clinic. I've worked on the front line for a long time. And when veterinary staff and nurses have to euthanize a healthy animal, it's heartbreaking. And we know that FIV cats could live a happy, healthy life. It's all unknown. So I don't want to have that emotional turmoil put on our vet service providers. And also, I don't want volunteers who are volunteering for our program to feel that we are making decisions that don't outwardly appear to be welfare prioritized. Because at that time, an animal could look perfectly healthy and you can't predict the future. Also, practically, I don't feel it would really allow us to stop the spread of FIV within a community cat care program. So feline immunodeficiency virus is primarily spread from fighting between cats and from bite wounds. And we're talking puncture wounds, canines, going deep into muscle tissue. If you sterilize the cats, if you neuter your males and you sterilize your females, you provide them with controlled feeding, you have a healthcare system so that no one's in chronic pain and feeling miserable and having a grumpy day, you get less fighting. So I have decided as a vet and CEO of AWAD that our primary focus is TNR. Sterilise, sterilise, sterilise. And for the money that we'd spend on FIV testing, for likely not much impact on reducing the instance of FIV in those communities, we're putting it back into TNR and also for treating what we can treat. How does it look to the wider community to make those hard decisions? I do have one community that's not AWAD associated. It's a grassroots community funded by the volunteers in that community, and they are doing FIV testing. And we've had one cat test positive this year from that community, and the cat was perfectly healthy, and sadly they were abiding by their own rules, and the decision was to euthanize. Yeah. And then I see the impact on the nursing team, and it's tough. It's a tough day at the office when that happens.
It is. That's one of the main reasons I asked the question, I think, because we TNR our warehouse cats here, and we do screen, and it is hard work. And I would have thought from my time in clinic that it's one of the main challenges to a TNR program that not ends it necessarily, but people lose enthusiasm for it because they don't want to have to make that decision, and I understand that, and so that becomes quite difficult. So I understand the reasoning behind not doing it as one of the hurdles to other TNR programs that haven't worked
100%
so well.
And one of AWAD's sort of core values is transparency.
Yeah.
So if anybody asked me the same question you just asked me, I'd give them the same answer. And that would be, if I had chosen to do FIV testing for our communities, I would have transparency with our volunteers. And I am convinced we would lose volunteers because they wouldn't agree with it. It's a hard policy.
And exactly like you say, we don't, or certainly I wouldn't do. When I first graduated, we would have different conversations with clients with privately owned cats that maybe went inside and outside and had been diagnosed with FIV, to the conversation that I would have today, 17, 18 years later. We know a lot more about the virus now. We know how these animals can survive with the right care. So it's not necessarily the rules are outdated, but I don't see any reason why TNR programs wouldn't start to think slightly differently in light of what we now know about the virus and the likelihood of it spreading. And as you say, the actual incidence in the population, is it really a big factor in the quality of life of these animals, whether they have it or not?
Yeah, 100%. So at AWAD, what we're focused on is making sure that we have everything else in place to make sure they have good quality of life, even if they have FIV.
Yeah.
And like I say, and I think this comes again from working as a vet and knowing people and knowing the impact that euthanizing a cat with FIV has on that person. It's being able to say, what can we do to mitigate that in the communities, and where are we best putting our funds? The goal of any community cat care program is always population control, right? So put your money into TNR.
Yeah.
Like if someone said to me, I only have X amount of money and I need to control the cat population in this area, where should I be prioritising my funds? TNR. Prioritise TNR, because the community will always put their hands in their pocket to feed. The cats will advertise themselves and meow at people's doorsteps and get food. And lo and behold, they'll hunt pigeons or rats, which they're designed to do. Cats are designed to survive. They're designed
community benefit.
They're designed to survive in extremes of temperature. Look at how they thrive in Abu Dhabi. They're very adaptable as a species, felines. So if you only have limited funds, your focus should always be TNR. And don't lose focus of TNR. Like a lot of people, they start off going, right, I'm going to TNR the cats on my doorstep because I recognise that that's what I need to do because this cat's already had one set of kittens and I don't want any more. And they'll TNR the mum, and then one of the kittens will go out and get a broken leg because that's what kittens do. They're not very streetwise, they get hit by a car. And then the focus becomes spending all the money on fixing a broken leg, and the other two kittens get forgotten, and then before you know it, they got pregnant, and then they had kittens. never lose sight of the end of the goal of TNR. So TNR first, and then if you're blessed to have resources, capacity and funding to help beyond TNR, expand what you can do. That would be my advice to anybody.
Yeah. And the goal is also to live alongside this group of cats healthily, if you see what I mean. It's not to sort of get rid of them instantly. So most of the volunteers, I imagine, are animal lovers and animal welfare advocates. So I think I've certainly seen in clinics that when you have rescuers who are starting to do TNR programs, I've had the conversation with them and they say, I don't want to screen for a disease because I don't want to know, because it would, you know, they do know their cats quite well and it would break their hearts to have to act on a positive. So then you find that people just say, oh no, they decline to do the test, they refuse to do the test. So I think I understand where you're coming from, 100%.
Animal Welfare Abu Dhabi will screen if it becomes clinically relevant, though, Hannah.
Okay, so if the cat presented with symptoms that
if we had a cat that we'd already sterilised previously,
okay,
and then it got flagged as a sick cat in the community, and it came in with clinical signs that might be relevant to an infectious disease like leukemia, FIV, I guess. Haemobartonella felis is another common one, the blood parasite spread by biting insects. We'll screen for things like that if it becomes clinically relevant.
Part of the healthcare side of things, yeah.
But we would never just do routine screening. It's not in our protocols currently. And I guess as long as I'm the one doing the strategy and designing the program overall, I don't see it coming in. I don't see the benefits financially or financially to the program, to the cats in terms of reducing the incidence of FIV in the population. It's ubiquitous. All I know is that it's ubiquitous, and if you remove a couple of cats with FIV, you're not going to change spread. What is going to change the spread is focusing on TNR. So we'll only do if it's clinically relevant and it helps us make decisions for that individual at that time.
Perfect. For decisions regarding the healthcare, so injuries, sickness when they come in, or afterwards, after they've been TNR'd and you're sort of monitoring, or your volunteers are monitoring that population, are there limitations on what healthcare you will provide for those cats as well? So the idea obviously being that they go back into their colony fully able and that sort of thing.
Yes.
How does that work?
So when a sick cat comes in, and a sick cat could come in with any manner of problems, some are simple to triage and treat, others are complex. A decision is made based on budgeting, because we do have a sick cat budget per cat per year.
Fine.
And we need to see how that fund is going, whether that cat's had its allocated money for the year
Some
already.
are clumsier than others, yep. Important.
Also the care system for that particular cat. So some cats we don't really know. They are genuine community cats. We hardly see them. We TNR them once, we don't see them again. Other cats are better known in the community. They're doorstep cats. They've got a better care system.
Yeah.
Somebody is advocating and feeding that cat. So that might change clinical decisions.
And able to monitor their
recovery.
recovery.
They're able to monitor their recovery. And also what is the nature of that community cat? So some community cats are super fearful, quite rightly. And putting them in a veterinary cage for recovery is the worst thing for their mental health. And if they're fearful, stressed, they're not going to heal. So it depends on the personality of the cat and its indigenous nature, the care system for the cat, the budget, and of course, what's the presenting health issue. I can tell you that so far this year, we've euthanized 6 cats due to health issues that were unable to be treated within the realms of our protocols. And we didn't take any of those decisions lightly. The latest cat was a cat that presented with a large tumour on her leg. She was an older cat in the community, one of our communities, who'd already been TNR'd prior to AWAD coming in with our programme. And it was very obvious to the doctor that saw that cat that it had a cancerous process going on. And straight away, it was a decision that I had to make. It was sad. Even with the care system, the cat can't go back to the community. Even if we decide to take it out of the community and give it, try and get it adopted to a family, its longevity is not guaranteed and it's costly.
Yeah.
So that was a clear-cut decision. Others are not so clear-cut. and the team at AWAD do agonise over these decisions, and I assure you, and I assure everybody, we make them prioritising what's best for the cat and its all-encompassing situation.
Yeah. I've always thought, I heard this quote years ago, that animals don't really care about the quantity of their life, they only know about the quality of their life. And I've said that to myself quietly so many times in consult, and I've said it to owners as well. So dealing with pets, you know, that's what you have to, I feel you have to consider. And if the quality of life cannot be guaranteed, then, you know, that helps guide your decision-making process. Slightly different circumstances with TNRs because we're looking at their recovery and looking at where they can be to recover. But I like to come back to that and think that's my guiding point as to what the quality of life is going to look like for that animal in the future.
And I think that's a reflection that animals truly live in the moment. Yes. Humans need to do that more, right?
Yes.
I'm not saying make some crazy decisions now and quit your job and storm out the studio, but we need to live in the moment, right? And that's what animals do. They're not thinking about, 10 years down the line. They're just enjoying every day and going about their animal business, aren't they?
Yeah, and knowing how much discomfort they're in or how much pain they're in right now. So, no, I think that's very sensible.
The other thing we do in our communities is same-day release for TNR.
Ooh!
I have seen, as a frontline vet, various approaches to people doing TNR. And the biggest one that people always agonise about is, number one, how am I going to get the cat to the surgery in time for the slot, and can I bring it in the night before? And then the other one is, how many days can I keep it in the clinic afterwards so it recovers before I release? And again, keeping some of these community cats, I would say the majority of these community cats, because the life they know is being free in their community to make their own choices. And as soon as you take everything that's familiar to them away from them, and you take away the ability for them to escape or to flee from a human, they're in a fearful state. They're constantly on edge. So for me, making sure that you focus on as little time as possible in a trap cage and getting them in and out as fast as possible from a vet clinic, that's the priority of our programs. So our protocols are that we don't let cats spend more than 24 to 36 hours in a trap cage. That's the maximum we'll push it to. And we do same-day release for males and females. Now for males, Hannah, you'll agree with me. Same-day release, right? And I don't mean to be disparaging of the males in the world, but they have it easy, right? Compared to us females when they get sterilised.
Speaking, yes, they definitely have it easy.
Everything is external.
It is.
It's quick.
Yep.
One little snip.
Yep.
And we're done.
Yes.
But ladies, it's more invasive. It's abdominal surgery, and you are going through muscle layers. So,
peritoneum.
We need analgesia. We need a little bit longer.
Yeah.
So how do we manage to sort of tailor it to same-day release? So first of all, approach to surgery. The vet service providers that Animal Welfare Abu Dhabi is in association with for this year are all doing left flank spay. Midline is only used in late pregnancy, where you need just better access and the size of the incision flank would be too painful.
Yeah.
So a flank incision allows a smaller incision. It allows a quicker approach. I mean, I was taught left flank spay because I'm a British vet, and that was our approach. Whereas in the rest of the world, the standard approach is midline. But I find that it's actually, once you get your skill set honed and you're regularly doing flank spays, it's quick in, quick out. And you don't always have to take the uterus. You can just do a variectomy, which means it's incredibly fast. So you've got a small incision, quick access, and there's various techniques you can use to close the muscle layers to speed up your entire process. And the best thing about a flank spay is that you can see the incision from a distance as a caregiver. It's a smaller incision and it's on the left side. So a lot of people worry that a cat, when it returns to the community, is going to be too active. It's going to climb up a tree, it's going to jump out of a tree, the incision is here, all that pressure of the abdominal contents with gravity. And yes, I've seen it, I'm sure you've seen it, where an incision has broken down and things that should be inside have come to the outside. No one wants to see that.
No.
Left flank, small incision, no pressure on the wound.
No, it's not.
They can jump straight away. It also means if a cat is nursing young kittens, the incision is here.
Yeah.
And the queen can easily still nurse her kittens without any discomfort. And that process can immediately be picked up the same day. So we get them in the morning, ideally. They have a left flank spay. They get released early, late evening. And I can tell you that out of over, I think we're nearly up to 100. We're nearly up to the 100 mark for this year across our communities. Of 100 cats that we've done, and assuming that 50 of those will be female, 50-50 split, we've only had one that chewed her stitches and had to have a little restitch. The rest have been fine, and they've all been released same day.
Amazing. Okay.
Yeah. The only exception is perhaps heavily pregnant cats that have, again, a caregiver that can monitor them.
Yeah.
They have been kept in a crate in a safe environment at the caregiver's house for like 24 hours extra.
Okay.
We haven't kept any in the vet clinics yet after
That's
routine
really
neutering,
interesting.
because a vet clinic is the most stressful place to be. And also, if you're not vaccinated or you don't know your vaccine status, don't go hang out in a vet clinic. Vet clinics are clean, but there are a high volume of patients coming through, and you're in a vulnerable situation like you are when you go to a hospital as a human.
Yeah.
So yeah, same day release.
I like it.
That is a really, really important thing. And it saves money for your program.
Yeah.
People are spending a lot of money hospitalizing cats that don't need to be hospitalized.
True. I think the other thing that I would add to that to support that idea is, so we've had the Zero Pain Philosophy team on when they came to visit us, and also speaking to Dr. Catherine with her background in behaviour and anaesthesia and analgesia. I think we know a lot more now about how fear and sort of stress on the body can make your pain perception worse. So for these cats, we can only imagine that even with analgesia on board, if they're fearful, it's not going to be as effective as we would like. And therefore the goal, which is to keep them rested and help them recover and keep them comfortable, is not being met as well as we could do if we released them early as well. So again, another example of what we know now versus possibly what we knew when I graduated has changed.
And stress prevents healing.
Yeah.
These cats won't recover and won't heal because they're stressed out in a vet clinic cage. And with regards to analgesia, I did go to the Zero Pain Philosophy workshop that FB companies set up. It was really, really insightful, and it gave me
amazing, wasn't it?
It gave me some little pearls of wisdom that I've carried through to my clinical work, particularly for arthritis dogs. One of those pearls of wisdom was the use of subcutaneous ketamine.
You can say.
So I was already using it. I was already using it for dental cases in cats. For like longer analgesia after multiple extractions, and I have started using it more for arthritis in dogs. But we actually do use it a lot in our community cat care programs for longer term analgesia. Okay. So let's say we had a cat that was spayed, heavily pregnant with a few teeth extractions, subcutaneous ketamine. And then I know that on top of its non-steroidal it got that day, the standard injection we give, it can have longer analgesia. And I can say to my volunteers confidently, no analgesia is on board for longer than 1 day.
Yeah.
And did you know that meloxicam can be given at 0.3 mg per kg as a one-off dose to a cat?
Can it really?
For TNR. I've not started doing it because we have vets had a fear of non-steroidal anti-inflammatories and hydration status and renal perfusion.
Yep.
And obviously we're in a hot country where cats maybe aren't drinking as much as they should. So I'm still sticking to the standard 0.2 mg per kg.
Okay.
But they recommend if there's no follow-up with oral, you can do 0.3 mg per kg.
That's very interesting.
So these are ways that you can also combat some of the reasons people justify for not doing same-day release.
Keeping them in, yeah, exactly, so they can have an oral.
And again,
before they leave.
if I wasn't a vet, as well as CEO of AWAD, these strategic nuances wouldn't be able to be adapted to these community cat care programs.
Yeah.
So,
and it needs to be evidence-based. It needs to be scientifically sound, which it sounds like it is. So that's brilliant.
Yeah, I've just given you some of our pearls of wisdom.
You have. I love it. Thank you very much.
There's another pearl of wisdom regarding community cat care programs: microchips.
Okay.
So, microchips could be bought by the people running the program, and then you ask your vet service provider to implant them, if you so wish.
Okay.
Because that would save the program a lot of money. If your goal is just to have your animals identifiable, but cost is prohibitive, there are workarounds. You could find a reputable source of microchips, which are a standard size, and they also have good readability, and then you could provide those to your vet clinic that you have this great relationship with, because I always encourage people to have a relationship with their vet clinic for the benefit of them, their program, and the cats, and then ask them if they'll pop the microchip in when it's anaesthetized, rather than buying from the clinic where there is a significant markup on such items.
Interesting. Like that. That's a nice tip. So we've talked a lot about the community cat care program.
Yes.
What other initiatives does AWAD have up its sleeve for the future?
So for 2025, we have 4 other initiatives or areas we're going to be working on and launching operationally, structured programs. And these initiatives are designed from our strategy research phase to animal welfare challenges that exist right now. Number 1 is we are supporting the Animal Welfare Department of Department, Municipalities and Transport in their new companion animal registration system.
Oh, okay.
Believe it or not, Hannah, Abu Dhabi now has, at long last, a set companion animal registration system. It's piloting this year. It launched in February, similar to AWAD.
Yep.
And at the moment, it's invitational. It's only for dogs and cats. But essentially, in a nutshell, you register your dog or your cat when you go for your annual vaccines at your regular vet clinic. And then your dog or your cat with its microchip number is registered to you as the owner on the TAM application, linked to your Emirates ID, such that if you should leave the country or want to transfer ownership of that animal, you need to clear the pet from your TAM app before you can do so.
So it's just that one step further than what we have in Dubai.
Yeah, it's essentially more watertight.
Yes.
And it's obviously the key operational initiative we need to prevent animal abandonment and to promote responsible pet ownership.
Yeah.
So now when you go to a pet shop in Abu Dhabi, or you purchase a pet, or you adopt a pet, you have to register that cat or dog on TAM. So it's going to encourage people from the outset to think, wow, this is a lifetime commitment. I'm tied in.
Yep.
I'm
accountable.
Yeah, I'm accountable. So it's the key to lowering animal abandon rates, for sure. And that is where we all agree.
That's a challenge.
That's a challenge. It's a challenge that needs addressing.
Yeah.
So I'm super happy that it's now launching in Abu Dhabi, and I'm super proud that AWAD get to support the initiative. We'll be supporting by promoting registration, helping people to navigate registration if they're confused, and also later this year, financially, some people might find challenges to registering their pets if they've got multiple pets, because your pets need a microchip, a rabies vaccine, a cat or dog health vaccine, a veterinary health check. AWAD intends to do some pop-up clinics to promote registration, and if your only barrier to not registering is a financial concerns about the cost, we're going to provide some hopefully sponsored vaccinations and a microchipping service by vets who will volunteer their time, and we will help you on board. That's what we're going to do as well as an extra step to support that initiative.
And then hopefully will it become mandatory in the future?
It's mandatory from
now.
Mandatory from next March.
Oh wow, okay, that's brilliant.
But it's going to become mandatory for pet shops and breeders from August.
Lovely.
Which is a key as well. A key step is to make sure that pet shops register their stock, and that breeders also register the animals, dogs and cats they're breeding, before sale to pet shops and before sale to people.
Well, that's very good.
Yeah.
Because again, from clinics, that's another challenge.
Yes.
Like it.
So that's one initiative. The second one is Animal Welfare Abu Dhabi will have a designated WhatsApp business line. It's going to be a trusted avenue of communication with AWAD for all things animal welfare related. We will also use that channel of communication to direct people to the appropriate entity with jurisdiction to follow up on anything that might contravene animal welfare regulations. AWAD as an entity does not have legal jurisdiction to enforce laws, to fine people, to go and inspect people.
Okay.
We do have the connectivity to divert and to channel those inquiries to the correct government entity, who I assure you will act. I personally, and since I started as CEO of AWAD, have engaged with the correct government entities to relay information about contravention of animal welfare laws. Every single one of my concerns has been acted upon.
Okay.
It's just about getting the information out there to people and giving them the confidence and encouragement to use the current systems. There's no gap. The gap is people not using the appropriate channels.
Mm-hmm. And knowing who to contact.
But the helpline will be much more than that. It will be a general trusted port of call for any animal welfare inquiries. How big, how small, we'll take them all.
Perfect.
And then we have pets across borders.
Right.
This is a very I guess it's a much needed initiative. Logistically, it may be quite challenging to launch and to get the information correct from our side to disseminate that to the community and wider audience. So we recognise that the UAE is a very transient population. People do come with a plan to stay for X amount of time, but sometimes plans change and they change at short notice. And if people haven't made provisions and financial savings for their pets, they can be left with a situation where they're trying to find funds for themselves to leave, let alone their pets. We would like to partner with designated pet travel companies and designated pet travel service providers like airlines to streamline information about how to do an export yourself to save costs, and also to get discounted exports from AWAD referrals for people genuinely in need. That initiative also will extend to adoptions overseas.
Okay.
So there's many animals in Abu Dhabi that are looking for forever homes, and we do find that the homes are unfortunately not in as much supply as the demand. So it's well been known for the last 3 to 5 years that there is an avenue where people in other countries might want to adopt a UAE cat or dog or rabbit even. So we're trying to open up sort of associations with organisations in various European countries to start with, because it's simpler for export and a little bit more economical, to try and facilitate overseas adoptions.
That's nice.
Animal Welfare Abu Dhabi is not a shelter, and we don't focus on rescue directly, physically, and housing animals to rehome them. But through some of our initiatives, we have animals that are currently looking for homes.
Okay.
We could send them overseas if there's people out there that are interested in overseas adoption, although we'd love to home them here. And the animals that we currently have to home, we have a rabbit, we have 7 cats, and we have 4 dogs through one of our partnerships with the Pet Hotel and Zoo Vet Centre.
Okay.
They have a kennels where dogs have been sadly abandoned or left after boarding. They had 8 dogs when we started our partnership. They're down to 4. So we've partnered with them to try
50% rehoming rate.
Yeah, already.
Since
sort of March time.
Amazing.
But we have 4 dogs we're supporting for them to get them homed.
And how are you supporting them?
Oh wow! Well, first of all, SV Company stepped in kindly again through Royal Canin, and Royal Canin are providing the food. Because ultimately these dogs aren't paying for boarding. So the food is in their expense.
Yep.
So Royal Canin have kindly feeding them premium nutrition, so they're ready and tip-top shape for new families. The Pet Hotel provide free boarding. They were doing that already, but now there seems to be more of an end point and a purpose to that. The Zoo Vet Centre provide the veterinary care and the sterilisation, microchipping, vaccinating. And the key component, Happy Hounds dog training. Happy Hounds go in 3 times a week and they train these dogs to make them social, leash trained. They work on little habits they might have built up or picked up which aren't conducive to homing, so jumping up.
Bad manners.
Not bad manners, just rewarded behaviours.
Yeah.
Because dogs' behaviours don't perpetuate unless they're rewarded. So, of course, some people think it's endearing for a dog to jump on them.
Yes.
But when a big dog jumps on a small child, it's not endearing, it's dangerous. So they're going in and they've done some amazing work so far. And they are the key to the success of that partnership. Because having a dog that you can literally just put on a leash, walk over to your car and it jumps in. And then it fits in with your family during the trial period where you're fully supported by AWAD and by Happy Hounds. There's no reasons not to come and view the dogs and take them on trial because everything is covered for you. So yeah, those animals that we have for adoption, they're all available to view on our Instagram account under a little adopt highlight.
Amazing.
And we do keep that up to date every week. The other exciting initiative this year is Positive Standards Programme.
Right.
So Positive Standards is essentially a programme designed to encourage pet shops in Abu Dhabi to improve their welfare standards.
Okay.
There are clear guidelines now for pet shops produced by Department Municipalities Transport.
Okay.
DMT provide these guidelines to pet shops, stating what the minimum requirements are. For example, you shouldn't have prey and predator species next to each other. The cages should have a solid floor on them, not be slanted, which is very uncomfortable to sit on for 24 hours a day. Animals should be taken out of cages for enrichment at set periods, rather than being confined 24 hours, 365 until they get sold. So we are trying to encourage pet shops to join our kind of positive standards scheme where we would say this is a good pet shop.
Okay.
We're not encouraging purchase. We are 100% pro-adopt over shop. But we would like to encourage pet shops to ensure that the welfare and the standards of their stock is lifted and elevated.
Yeah.
In addition, we are already we've already got a lot of volunteers registered for this aspect of the Positive Standards Programme. We have mystery shoppers. So you, Hannah, as a volunteer, could say, I want to volunteer to be a Positive Standards Ambassador. Great. So you would then, or an Animal Welfare Ambassador, you would sign up to be assigned a pet shop, two pet shops this week that you go to in plain clothes with your children, have a look around, and you'll have a checklist which has been fully aligned with the current regulations and approved by DMT.
Okay.
You'll fill it out in the car afterwards, after you've been, and if you do find something which may contravene some of our key parameters we're looking out for, some of our key mishaps that pet shops perhaps, if they aren't abiding by these regulations, then you'll just go and fill out a little form, and then that gets fed back for action by those with jurisdiction.
Okay. So
it's completely within the realms of the current system.
Yeah.
And obviously we won't give you the same pet shop every week because they might start to, that's a bit suspicious. Hannah comes twice a week, every week with her children and, But yeah, so you can be an Animal Welfare Ambassador through the Positive Standards Programme. And that gives, operationally, it gives more people on the ground. Because one thing we've also discovered from talking with government stakeholders and animal welfare is they don't always have all the resources we think.
No.
So if the resources aren't there, can we fill that gap? Yeah, we can fill the gap, and we can fill it within the realms of what's possible legally and ethically by having a volunteer that goes to the pet shop, has a look around and goes, well, that doesn't look like it should be that way. Oh, it shouldn't. I'll tick a box for that and report back.
If there are people out there, either veterinary professionals or non-veterinary professionals and animal welfare advocates that would like to volunteer, how should they do that? Should they get in touch with you? Is there a way to do that yet? Or?
Yes. So our website is very much in process. Even as I sit here, hopefully some pages have been created from the content we've submitted.
Brilliant.
It'll be done hopefully by end of July, beginning of August. That'll be a trusted resource to go to.
To AWAD.
Yeah, so it is myawad.ae, okay, our website. Until that time, our Instagram account is always up to date, which is awad.ae. And there's a link tree on there with every form for different matters. So you've got your volunteer form, you've got your community cat care program volunteer form, you've got adopt application form, and we have a contact us form on the Instagram account. Okay. That's the best way to connect with us right now. Or you can email us, and our email is also on the Instagram account.
Amazing. Can you view the cats and dogs and the rabbit that's up for adoption? Are they featured on your Instagram account?
They are featured under the adopt highlight icon It's always kept up to date weekly. If you would like to view any of the animals we're supporting, then please just get in touch with us and we will arrange it soonest.
Amazing.
Yeah.
Well, thank you, Dr. Rachel. I have one other question for you, and that is, what animals do you have at home yourself?
The answer is too many, but not
uncommon for
not a crazy number.
Okay.
I am very sensible with how many animals I have committed to myself, because I'm a great believer in that you only commit to what you have capacity to care for. So currently we're at one dog who was adopted here in 2013 when I first started working at British Vet Centre. She came as a stray and was destined to go to shelter. She was siphoned off to our house. I've got 3 special needs cats.
Okay.
I'm a big sucker for a special needs cat because I have capacity to care for special needs. So I have a cat who unfortunately has no eyes. They had to be surgically removed. But she is absolutely fine. She gets around just fine. I have a cat with 3 legs. Again, it was removed as a kitten due to an injury. And I have a cat with a spinal injury, which is more challenging. She, unfortunately, is 95% continent in terms of urine, but occasionally she does leak urine. So I've built a catio for her.
Oh.
She lives outside, and she loves her outdoor life because that means that she has a great life and I have cleanliness, because unfortunately I can't put her in a diaper. I don't believe in putting animals in diapers, and she does sometimes leak a little bit of urine, so I accommodate her. And then I've got some rescue fish.
Okay.
Last summer I found some fish abandoned in a fish tank. It was an all-time low point for my love for humans that day. So the tank was abandoned with some lovely shiny stones and sadly 2 fish still in it. So rather than wait till midday when they might have become fried fish, I took them home. And then I got them 5 friends because I researched fish and they need friends. They need to live in a shoal, so they now have a little shoal. And then I have
Now you have a shoal of fish.
2 rescue axolotls as well.
Right.
They are a complicated little species, and I won't go into the details, but all I would say is they're probably the most challenging rescue I ever had, but I love them, and we do look after them.
What are their names?
Walnut and Ghost.
I don't know what you call axolotls, so I'm
Yeah.
curious. Walnut and Ghost.
Ghost
Fine.
is albino,
Oh, right, I see.
so he's white with red eyes.
Fine, yeah.
And Walnut is like a wild type, so he's dark, like a walnut colour.
Makes perfect
The
sense.
kids named them. So I think that's all my animals at the moment. Yeah.
Amazing.
Oh no, I have the foster bunny.
And you have a foster bunny.
Sugar Bun is with me. Anyone who goes to our Instagram and sees Sugar Bun is with me. And I was slightly late this morning because I spent my time filling in a hole in my garden where Sugar Bun has been digging furiously and enjoying her free life in my garden.
Right.
So, yeah, if
That's something that must be taken into consideration if someone wants
Well, it's
to adopt
natural behaviour. She wants to dig. I can't be upset with her for fulfilling a natural behaviour.
She could landscape for you.
Yeah, maybe we'll have to have a discussion about where she can dig and what she can create.
If only it works that way.
It was a free gym workout putting on the sandbag, though.
Always see the positives. Always.
Upper body workout for free.
Yep. Saves money from the gym. Well, thank you so much for your time today, Dr. Rachel, on coming in and explaining everything that is happening with AWAD and your role. We've really loved it. So thank you so much. And I hope we speak to you again very soon.
It was my pleasure, and thank you for allowing me to talk about my personal things and, importantly, about animal welfare Abu Dhabi.
I'm just delighted I heard about Sugar Bun.